David, first off, tell us about the meetings DAP Health has been having with owners of gay resorts and the actions these owners are taking regarding monkeypox.
The meetings have been very successful, and I've been really touched by the owners of the resorts in the Coachella Valley. Most of the men who own them lived through the AIDS crisis, right? And so they have reacted very, very positively to cooperating to ensure that monkeypox doesn't spread in their establishments. My hats are off to All Worlds Resort. As soon as we started speaking with them, they said, you know what, we are immediately going to close down the maze, which is their area where adults come to recreate. And so they've closed it down, which is so admirable. CCBC is partnering to provide space to do vaccines in as soon as vaccines are available. So it speaks volumes about how special the LGBT community is and how much they care about one another.
Absolutely. Is it time for us to have a frank conversation about monkeypox?
Absolutely, right. We don't want to stigmatize the LGBTQ community. They have been stigmatized enough, particularly around public health. But we need to talk frankly, honestly, and directly with gay and bisexual men that 96% of the cases in our country of monkeypox are affecting gay and bisexual men. And so they need the honest information so they can make the best choices to protect themselves. They are at risk right now.
Absolutely. I'm curious to know your thoughts, David, on how the state and also the county have handled the outbreak so far and also vaccinations.
We don't have enough vaccines in this country. That is period paragraph. And we needed them in May, right? We are now in July and the virus is replicating quickly. And we're seeing that all over the news right now. So I'm talking to our congressman's office, talking to the state and to the county daily. They are all extremely concerned. They're all working hard to secure more vaccines. But Peter, at the end of the day, there just is not enough to meet demand. And so people who are at high risk could be exposed to the virus long before they get the vaccine. And that is a huge public health issue.
How is DAP Health getting the message out to the community, providing fact-based information about monkeypox?
That's it. People need the facts. The fastest way right now is to go to our website, daphealth.org/monkeypox. On there are certain sections of information that is relevant to the community, particularly the tab on safer sex during monkeypox. Encourage people there to go and read that. We're also holding town hall meetings. We're educating the community by social media. As you mentioned, we're talking to the owners of all the adult resorts in the Valley and doing interviews such as today. So thanks for turning your attention on it.
Of course. Anything else, David, you would like to say before we let you go?
If you're at high risk, get the information, talk to your partners about it, and make the changes you need to make, because chances are you will not get the vaccine before you could be potentially exposed. And this is a horrific disease state, and I don't want anybody to get it.
Before we let you go, are you surprised at how the business community has responded to making changes to prevent monkeypox from spreading?
I'm touched by it. I love to see our community come together in times of crisis and support one another and problem solve. It makes living in the Coachella Valley worth it and what it's all about. It's why we all live here.
You're right about that. David, as always, great to see you. Thanks so much for joining us.